Welcome back, and now today we're going to be talking about Chapter 8, the muscular system, and some specifics about muscles. If you have not opened your CD that comes with the text, you will need to do that by this particular point because I'm asking you to watch one of the animations on there for the purpose of learning the physiology of muscle contraction. So this will be your opportunity, if you have not done that to date, to open that package, put it in your CD player or where your computer, your PC, however you're going to be able to visualize it. If you go to chapters and then go to Animation Direct, then by chapter, go to Chapter 8 and select the animations in that particular chapter to aid you in understanding contractile forces of muscle. So let's introduce some basics about muscle and the anatomy of a muscle fiber. We mentioned in the previous recording that tendons attach muscle to bone, ligaments attach bone to bone. If you look at this particular descriptor, you can see that indeed there are layers or components of your muscle mass, similar to when we talked about the osteons, or the animation talked about the osteons and the buildup of different cylindrical osteons that make up the density of bone. In this case, we're looking at the fact that there is a number of fibers that become more and more finite, and as they get to the very distal part of the fiber or muscle fiber cell, the term assigned to that most finite anatomic part is actually called the sarcomere, which is the contractile unit of the muscle fiber. The entire muscle fibers are actually covered in something called epimysium that you can actually see as the outer encasing layer. Between the fibers is another layer called endomysium. Muscle is supplied with arteries and veins, as you can kind of see the blood vessels at the south side of this pectoral. Each and every muscle fiber is made up of fascicles, and they are wrapped in perimysium. We're going to move on to the next slide. Again, whole muscles are made of fascicles. Fascicles are held together with connective tissue, and the entire muscle is encased in epimysium. All of these connective tissues merge to form the tendon. The sarcomere is the basic contractile unit of skeletal muscle. And again, you're going to want to go to that animation after the completion of listening to this audio and observe what happens when gated channels allow for calcium to enter and to affect the actin and myosin filaments that are located between the Z lines, which you're going to hear about, and how essentially it's kind of like a rowing motion that with some biochemical stimulation and also with nerve innervation in something called the neuromuscular junction, there is a stimulus to release the calcium to allow for the channels to open and for contractile or rowing-like forces to occur to move the filaments and then to return them to a relaxed state. In order for the sarcomere to perform its basic function, they need to always have oxygen and glucose availability and calcium available for contractility. Again, mechanism of muscle contraction, this will be best accomplished for you to learn this by watching that animation in Chapter 8. Definitely take note of these particular definitions: Z lines, actin, and myosin. And at the end of the animation, ask yourself the question, why is calcium required for muscle contraction and what is its role? Other terms you need to be familiar with in the muscular system are origin and insertion. Now, we don't really ask in GH 125 for you to learn the specific origins and insertions of all the muscles, but at the same time we want you to understand the concept of motion. An origin of the muscle is the attachment to the more stationary bone. The insertion of the muscle is the attachment to the bone, which is the more movable bone. And if you look at the particular bicep muscle at this point, the origins would be at the top towards the scapula. Insertions would be at the part that moves, which is the lower part of the arm, or on the radius. So that is actually where the beginning of that muscle and the end of the muscle in terms of origin insertion is located. Many people always think that their bicep muscle indeed actually inserts somewhere above the elbow, but it doesn't. It actually inserts distal to that. And when those muscle fibers contract and shorten, and contraction means to shorten the length, indeed you'll have a flexion motion or a reduction of the angle of that arm. And that is how most of our motions are initiated. We also have antagonistic and agonistic muscles, and what that means is muscles that are opposing the motion of the primary mover. So if again we look at the bicep muscle, when it is in the form of contraction, the tricep muscle would have to be in a place of relaxation, and vice versa. Now we're going to do a simplistic overview of the muscles of facial expression. And the first muscle we're going to talk about are those that are found in and around the face. Orbicularis oculi are actually the muscles that actually wrap around the orbit. Orbicularis oris actually encircle the lips. The function of orbicularis oculi are to close the eyes. Orbicularis oris is actually to draw the lips together, basically to pucker and basically to kiss. So those are the two on this particular PowerPoint slide that I would like you to be familiar with. Another one that you would want to be familiar with also that assists in the kissing motion is something called the buccinator or buccinator, which you can see located right here. Okay. In order to masticate or chew, the masseter muscle helps us to close the jaw. And as you note, it's inserted on the mandible, down here, and its origin in the more stable zygomatic bone is here. So if I were to ask you what are the two bones that the masseter muscle is attached to, you would say the zygomatic and down here, or the mandible. So that's mastication and the masseter muscle. Now there are certain muscles that help us move our head and neck, and one of them is the sternocleidomastoid. Now if you think of sterno as sternum, cleido as the clavicle, and mastoid bone, which is that bone that's found right behind the ear on the cranium, indeed, if you were to contract that muscle and shorten the angle of that, it would rotate and flex the head and neck. The insertion is in or on the mastoid bone, which is right here, and the origin is on the sternum and clavicle. Now some of the muscles that also aid in movement of the, I apologize, I've been sick, so I'm going to sneeze for a second. Excuse me. Okay, anyway, the trapezius muscle. And by the way, in your text in table 8.1, you can also find a review of the muscles that we're discussing here in the PowerPoint. The trapezius muscle extends the head and the neck. Its insertion is on the scapula, and its origin is on the skull and upper vertebrae. As you move through these muscle groups also, if you will try to actually contract them or tense them up or shorten the angle of these muscle groups, it might aid you in thinking about the motions that they aid our body in making in terms of full range of motion. So that's the trapezius. Again, functions in extending the head and the neck. Pectoralis major, and there's also a pectoralis minor, which is under the pectoralis major. In the cadaver when we actually do our cadaver lab. If you ever do get to take Bio 121, we'll actually be able to show you the finer pectoralis minor muscle group and the larger pectoralis major muscle group. And if we looked at pectoralis major, it aids in flexing and helping adduct, which means to bring closer towards the body, the upper arm. Its insertion's on the humerus, and its origin is on the sternum, clavicle, and upper rib cartilage. So you hear the sternum, clavicle, and the upper rib cartilage. The other muscle portrayed here is the deltoid. The deltoid muscle is actually inserted on the humerus, which is right here. It's actually a very large tuberosity that aids the deltoid to be stabilized. And its origin is on the clavicle and scapula, right here. Okay. The deltoid aids in abducting the upper arm. So if we were to shorten the angle of this muscle mass, it would elevate the arm, correct, and abduct the upper arm. The next two we have are the biceps and triceps. The bicep is responsible for flexing the elbow, and as we mentioned before, the bicep is originated on the scapula, and then it is inserted on the radius. The tricep brachii is actually aiding in extending the elbow when it's contracted, and its origin is on the scapula and humerus and inserted on the ulna. By the way, if you want to know where your radius versus ulna is, I did not mention this before. By the way, here's the tricep, here's the ulna. The radius is the bone that's closest to the thumb. So it's a good way to remember where your radius is compared to the ulna, even despite which position you might have that arm in. Okay, so the radial bone is always the one closest to the thumb. Now we have muscles that move the hand, and in your text they don't really give you a descriptor of these, but I want you to just kind of look at some of these finer muscle groupings and just think about if you were to shorten the length of them, would it make your hand close or extend? And sure enough, if you look at this flexor carpi radialis, let's see, we've got this muscle here, it inserts, here's the radius because it's closest to the thumb, and it would pull the hand in a shortened angle and flex the hand. Whereas on the other side, if we were to look at the top of our hand and we were to contract this flexor digitorum superficialis, indeed it would make our hand elevated when maybe we were laying it on the table and you wanted to lift it, your fingers upward. So this grouping, I would like you to be familiar with the flexor carpi radialis and the flexor digitorum superficialis. Muscles of the abdominal wall, or of the trunk. Now the external obliques compress the abdomen, and we find its origin in the lower thoracic cage. Okay, an insertion of the external obliques would be in the midline of the abdomen. The rectus abdominis, or that abdominal grouping that everybody wants to try to get their six-pack reflected in, is located right here. Obviously this is the umbilicus. And the rectus abdominis is responsible for flexing the trunk, right? Basically, that's why we do our sit-ups, which of course there are many different ways to improve the tone of this abdominal grouping. And it is actually has an origin on the pubic bone and insertion on the lower rib cage. And those of you who have ever had to do a large number of sit-ups and you've not been doing them properly, or you've been out of shape, you surely know that sometimes you'll have this upper abdominal pain the next day. And now you can see where those actual fibers are inserting and why you might be feeling that group of muscles be pretty sore the next day after overworking them. Alrighty, we have internal obliques right here, and internal obliques also help compress the abdomen. And we have external obliques, okay? And if you've ever done any workout at any of the clubs or YMCA, and a lot of the machines actually isolate these muscle groups, and it's a really good way actually to learn your muscle names and what they do, and plus it gets to work you out. So I would encourage you to try to actually move the body through the different muscle group capabilities, maybe reps of 12 times, so that we can maybe improve the tone of those muscle groups. Alright, now we have muscles that can move the lower extremities, and the gluteus maximus actually aids in extending the thigh. If you were to actually try to do like a swan dive or a yoga position where you're elevating the feet as you're laying on your abdomen by tightening up this gluteus maximus, indeed that would aid you in extending your thigh. Some of the muscles that move the lower legs include the sartorius, and this particular muscle indeed is originated on the ilium, which is this portion of the pelvic girdle, and then its insertion is all the way down here on the tibia, and it aids you in crossing your legs actually. So the sartorius flexes thigh and rotates the lower leg. We have a large group of quadricep muscles, which include the rectus femoris, the vastus lateralis, intermedius, and medialis. And this particular large group of muscles are actually responsible for extending the knee in this motion. And as you can see, the origin of the quadricep groups is either on the ilium or femur, and the insertion is down here on the tibial tuberosity, or the tibia. The vastus lateralis is actually that portion of the quadricep grouping that we use in infant injections, and they do discuss that in your text. I would encourage you to take a peek at that. Some of the muscles that move the ankle and the foot include the gastrocnemius, and for plantar flexion of the ankle, and if you look at the origin of this particular muscle, it's actually, you can't really see it all the way up here, but its origin in the gastrocnemius, which is really your calf muscle, is on the femur, and the insertion is on the calcaneus portion of the heel. And this is the tendon of the gastrocnemius, all the way also known as the Achilles tendon. Now, interestingly, as you age, this particular tendon, if not stretched properly enough and readily enough and regularly enough, can actually start to cause all kinds of little spurs to occur down here, with the possibility of also even a full rupture or tear of that Achilles tendon. So it's really important for the elderly that they're pulled through a range of motion on a regular basis to maintain flexibility of our tendons, including this particular one. Now, in your text, you're going to find some other descriptions of other muscles. For our purposes right now, we'll focus on the ones that I've included in the PowerPoint. If, again, you look at your text under clinical applications, it does discuss what muscle groups we might choose to use for injectables. Also watch your animations as they talk about movement in terms of flexion, extension, rotation, and if you look in your text, they also discuss adduction, abduction, pronation, supination, dorsiflexion, and plantar flexion. So the animation does a good job of going through this, but also the little games that you have in your modules will also aid you in the review of those motions. This will end our review of skeletal system, of the muscular group of the musculoskeletal module. Any questions, please don't hesitate to email.